Hi, my name is Ocean Walker and I'm an 8th semester nursing student, and I'm here today to explain and to educate the patient on the drainage system for a chest tube. So my patient had trauma and bleeding into the pleural cavity as to why he's getting a chest tube. So going into my patient room, I'll provide Andigene, introduce myself. Hi, my name is Ocean, I'll be your nurse today. And today you'll be having a chest tube placed. And I'll be here today to assist the physician with that. So you're having a chest tube placed because you have bleeding into your pleural cavity. So that will help take some of that fluid and bleeding off and help you to breathe better. Also, I will be assessing your vital signs, your lung sounds, making sure that you're comfortable and attaching this drainage system to your tube. Your tube will be sutured in and will have an airtight dressing around it, okay? So this is the drainage system that it will be connected to. And I'll be educating the patient about this. So these first 3 chambers is the drainage collection chambers, and it will collect all that is coming out of the patient. At the end of each shift, I will mark, date and initial the amount and document it. This is the water seal. It should be filled with 2 centimeters of sterile water, and during the first hours that the chest tube is placed, it should be bubbling, but after a couple hours it should stop. You will also see tidalin with this, and it will show that the lung is re-expanding. With each inspiration, you'll see tidalin. This part is the dry suction, and the physician will decide if they want the patient to be placed on suction to help pull that fluid faster. This drainage system normally should be placed below the level of the chest. So sometimes it will place at the edge of the bed right here, or sometimes on the ground it will be taped down, and this part will be connected to the patient as I stated before. I will also let the patient know that after the insertion of the chest tube, if they want to go to the bathroom, they want to be repositioned, they should call me so I could help them with that. Also, after the insertion of the chest tube, place this here, I will assess lung sounds, making sure that the patient is breathing properly. I will assess the site to make sure that there's no drainage and make sure that there's no crepitus, because we don't want that. That's basically hair escaping into the tissues. I'll also educate the patient that to expect this tube to stay for probably 2 to 3 days, depending on their situation and what's going on, and a chest x-ray will be placed to ensure that that needs to be taken out. And just providing the patient with comfort, because these patients will be in pain for the first couple hours or so. So that's my video. Thank you. I will also ensure to tell the patient that I will not be emptying this chamber, but replacing it after it is full with probably each shift. It depends on how much is coming out of the patient.